صافي، مدرس مساعد الطب النفسي في جامعة عين شمس. النهاردة أنا هقدم برزنتيشن هعرض فيها اللي وصلنا له من خلال رسالة ماجستير واللي اتنشرت بيبر في سنة 2021 عن البلازما brain-derived neurotrophic factor in Egyptian children with attention deficit hyperactivity disorder, supervised and published by بروفيسور منى محمود الشيخ, بروفيسور مروة عبد المجيد حامد, بروفيسور ريم حسن الغمري, and assistant professor جينا محمد الجبري. As a background, some points need to be highlighted. Attention deficit hyperactivity disorder is a common childhood onset, highly heterogeneous neuropsychiatric disorder. Its prevalence worldwide ranges from 3.4% to 7.2%, with a higher prevalence in Egypt reaching up to 9.4%. To date, still the etiology has not been clearly identified for ADHD. Some evidence support neurobiological and genetic origins, with much attention given to the dopaminergic and noradrenergic systems. One of the most studied neurotrophics is the brain-derived neurotrophic factor, which received much attention due to its role in the development and maintenance of the central nervous system. Various studies have pointed out the link between BDNF level and gene expression in serum or plasma to a variety of neuropsychiatric disorders. Although altered blood levels have been detected in many patients with ADHD, still the results have been mixed. Aim of this work was to assess the relationship between plasma BDNF level and diagnosis of ADHD, different subtypes of ADHD, and the severity of ADHD. Subjects and methods. Case control observational study. 90 children recruited during a one-year period from June 2016 to June 2017. The case group includes 60 drug-naive children newly diagnosed with ADHD from the outpatient child clinic at Okasha Institute of Psychiatry and Shams University. The control group included 30 children who were matched for age and sex and IQ with the case group, and included healthy children recruited from the children of workers at Shams University Hospital. Inclusion criteria, as we mentioned before, for the case group, they were newly diagnosed with ADHD, fulfilling DSM-4 diagnostic criteria for ADHD. Age ranged from 6 to 12 years old. Children with IQ more than or equal to 90 on the Wechsler intelligence scale for children, and the cases were medically free by history. For the control group, the searched children were matched for age and sex and the IQ with the case group, and included healthy children with no abnormal psychiatric or medical history. Exclusion criteria. Cases that refused to participate in the study: children with IQ less than 90 and children with comorbid psychiatric or medical conditions such as pervasive developmental symptoms, chronic disorder, Tourette's disorder, psychotic disorders, or any other psychiatric disorders were excluded, and also those taking chronic medications were excluded from the study. Procedures. After taking the approval of the Ethical Committee of Ain Shams University Hospital, all cases were subjected to informed consent that was taken from participants themselves or of possible and legal guardians. A full physical examination of the cases was carried out for the exclusion of any medical condition. Socio-demographic data was then recorded and collected from one of the parents using Fahmy and the El-Sherbini scale. A full psychiatric history and examination according to DSM-4 were performed using the TB schedule for affective disorders. Then intellectual functions for the cases and the controls were assessed using the Arabic Wechsler intelligence scale for children. Patient group or children in the case group were further assessed for the severity of ADHD symptoms using the Connors-Parent scale, revised long version as reported by parents. Finally, a 5 cc blood sample was collected from both cases and controls by a trained nurse to determine the level of plasma BDNF. Results: we found that as regards the socio-demographic characteristics, there was no difference between the cases and the control groups as regards the socio-demographic data, except for the family history of psychiatric illness, as higher percentages of the cases had a positive family history of psychiatric illness when compared to the control group. Distribution of diagnostic subtypes of the ADHD group: 8.3% of the ADHD cases had the inattentive subtype, while 25% of the ADHD cases had the mixed subtype of ADHD, and 66.7% had the hyperactive type of ADHD. Comparing the two study groups as regards plasma BDNF level, the plasma BDNF level was significantly higher in the case group as compared to the control group. Comparison between subtypes of ADHD regarding plasma level of BDNF showed that there were no significant difference between the different subtypes of ADHD as regards the BDNF level. Correlation between Connors parent scale scores and the severity of ADHD in children and the BDNF level among them did not show any significant correlation between them, between the severity of symptoms and the BDNF level as measured. Limitations of the study. Our entire case sample was selected from the child psychiatry clinic, which represents cases with more severe symptoms, and it was difficult to generalize our results to the general population. Our study did not consider the influence of physical activity, diet, or exposure to smoking, or other factors that would affect the BDNF level. The sample was underrepresented for the inattentive subtype. Conclusion: children with ADHD exhibit higher levels of plasma BDNF levels in comparison to age and sex-matched healthy controls. No obvious correlation found between the severity of symptoms in children with ADHD and their plasma BDNF level. No significant difference between subtypes of ADHD, different subtypes of ADHD regarding BDNF level. However, we must take into consideration that our sample was not representative of the inattentive subtype. Thank you.